Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not yet subscribed to my channel, please go ahead and do subscribe. This way, not only are you helping me, but you're helping so many other people find this valuable content. Also, if you don't yet subscribe to my Instagram account, link is below. Please also follow me. That way we can stay connected. Don't forget, I also have a free and my trans quiz in case if you're still wondering for you, down linked below as well as a complete free copy of my book, which has amazing reviews. So many of you love it. And that's one of the reasons why I made it free and accessible to all so that all of you can benefit from it. So go ahead and grab your free copy as well. Let's get rolling for today's video. Sorry, I just moved the camera. Don't mean to give anybody headache. For today's video, let's discuss in what order should transition go. So is there a particular order to gender transition? I have a lot of people reach out to me and ask me whether the order that they're going in is the right order. I have a lot of people who are asking me whether having surgery first before getting on hormones is the right way to go, or whether go on hormones before coming out is the best way to go, or if any of the other orders is particularly correct or accurate. And I don't think it's going to surprise anybody to say, for me to say, is that while there is, I would say, hypothetically speaking, a primer of an order, I would say, it's not even an order, it's more, like I said, a primer of the way people can do things, which is a little bit more, I would say, well, I don't even want to say linear because I don't think it's necessarily linear per se, because any order really is linear. But oftentimes people think of transition order in a way that you first become aware that you have dysphoria, you then figure out what your identity is. Once you figure out what your gender identity is, you then come out. So you step into social transition, you come out, you switch your pronouns, you start presenting more in your authentic gender. You may even legally change your name. Then you start medical transition in the form of some hormone regimen, whichever one is in alignment with your goals. And then you continue on this path. And then you step into a surgical transition where gender affirming surgeries do take place, if that's something for you. And that's pretty much it. That's usually the most common, I would say, signpost that people think about when they think about the order of gender transition. What I have learned is that there is no such thing as the order for gender transition. There's no such thing. And the idea of even the primers that we have today comes from a very old dogmatic way of practicing gender affirming care, where under requirements, people had to stop at particular signposts before they can progress. It makes me think of a game of life, where people had to live in their authentic gender for a whole year before they get green light and approval for hormones. Because of the archaic, I would even say, unsafe to some extent and very intangible requirements, the primer got established. And to this day, a lot of people, when they think about gender transition, they think about this primer. And I wouldn't be surprised if there are even clinicians who work with LGBTQ population who are not trained enough, educated enough, competent enough, I would say, who still utilize the same primer because they think that's the order of things. I have learned, again, that there is no such thing as order. There is only your order of things. In fact, in my private practice, when I create what I call transition roadmap for individuals, it is always situated within your context, your circumstances, your access to resources, and so many other things, including your expectations and your goals. Each client that works with me if you were to look at the order in which the transition takes place, it will be drastically different. I have people that have been on monotherapy for a year without even doing anything else in their life. I have people who had surgery first, hormones second. So just to show you a little bit how wildly drastic it is. And it needs to be different. It needs to be different because no two people are alike. No two people have exact same circumstances. No two people have exact the same goals about what they would like to achieve. I worked with an individual who had facial feminization, and it has been a year now, and they're still not on hormones. And there's a reason for that. I'm not going to disclose what that reason is, but there is a reason for that. So transition is one of those things that elements, all or certain elements of gender transition can be, while incredibly positive in your life and instrumental to your well-being, to your health, each one equally can be disruptive. And whether you look at the disruption as a good type of disruption, right? Remember, not all disruptions are bad. A lot of times when we live a life pretending to be something we're not, that disruption of living and navigating life in alignment with your assigned gender that you don't resonate with, that disruption is going to have to take place. And for a lot of you, that's a good disruption. So, but there's still going to be disruption. And sometimes the disruption is not what you wanted. Sometimes it's what you've been wanting to avoid. But because transition, one way or another, brings not only disruptions, potential disruptions, but drastic changes to your life, to your environment. For that reason, it is important to approach it in regards to how you are situated. So that's why should never ever be an order. Ideally, any therapist working with anybody who wants any element of gender transition would be working with a client to create a blueprint that works for them. And I think I said it in my other videos, where you even have to take into consideration a person's personality trait and characteristics. So if you have a client, for example, this is a very classic example, that is not only anxiety prone, but also prone to catastrophizing about the future, you want to create their transition in such a way where each step builds on each other by trying to eliminate potential catastrophizing and by trying to increase their sense of self-agency, confidence, and self-control, because that's what exactly going to combat any type of anxieties that they're going to feel. So while there is no particular order except your order of things, your order of how transition works out for you also has to be strategic in some way. And when I say strategic, I mean that it has to be logistically organized to fit where you're at in your life right now. And as I said before, all of those other circumstances. For that reason, there's a lot of individuals who, for example, transmasculine individuals who have top surgery first because they have so much chest dysphoria. They don't step into masculinizing treatment yet, even though they want to, because their life, whatever their circumstance might be, may not yet have an environment that is safe to do so. If somebody lives in a place where studying masculinizing hormones and actively outwardly transitioning physically in such a way is going to put their life at risk, well, guess what? A person is going to wait until the circumstances either changes or they have resources to move to a safer location. But top surgery is something, especially if a person been binding and already presenting with a flatter chest appearance. Top surgery is something that can be done and still maintain their the identity that they're living in order to secure their safety, but also alleviate dysphoria. So again, your order has to be your order. Don't be fooled. Please do not be fooled that there is this a primer for transition. There isn't. And if you're working with a therapist that tells you you must spend the year in your authentic gender before anything, first of all, you need to ask where this must comes from. Challenge them, ask them. My clients challenge me all the time when I suggest particular way to organize their steps. They challenge me all the time. Why is it, Dr. G? Why don't you think that I need to do this first? And I always have an explanation because I don't structure things for people without a reason. That's just not how I work. But a therapist who is not competent, who's following a dogmatic primer from thousands of years ago, is not going to be able to back up or give you answer because, again, they're just following something. They're not thinking about what it is they're following. So challenge them. If they're not able to give you a good answer, or if what they present to you doesn't sit right with you, guess what? You can change therapist. You don't even need therapists to go through gender transition, by the way. And you can organize steps in accordance to what works best for you. Sometimes when we think that we're organizing some steps and they're actually going to be benefiting us, they sometimes don't. For example, I had people who they started hormones, but they are not out yet, and they also started planning other things, and they're not even out to their partners, and they're waiting until particular moment in their headspace expectation that they created until they come out. And sometimes, depending on their personality and what their relationship is like, what the scope of the relationship, in my point of view, that might not be conducive. You're actually creating, it's almost like you're creating a potential grenade that is going to explode and have even more damage for you to control. So it's important to also, if you're planning steps by yourself, to be very objective and understand why you're planning things the way you're planning, and will they actually help you or will they actually deter you? Sometimes we're afraid to take steps forward, and because of that fear, we are maybe dancing around things, right? So I have clients sometimes who come to me is already in transition, and they have their own way of doing things. And sometimes I look at it and I look where they're at, and I propose, hey, actually, we need to move you a little bit further along. And here's why you're still struggling, because now you don't realize it, but you're actually avoiding by taking these tiny, tiny steps, right? Sometimes people do the opposite, they speed up. I just had a client recently that I'm working with, a wonderful, wonderful client. And I told them we're going to do baby steps, and then the next session they've done this micro steps, and they're now in a little bit of anxiety prone, catastrophizing, worrisome mode because of it. And I said, yeah, remember I told you you're all or nothing personality, and we need to be careful not to do all or nothing, and you just did all. So it's okay, it happened. Things happen, and that's all right. And we'll find a way around it. But this is why the baby steps were conducive to you particularly. So there's always got to be a strategy and idea behind it. And sometimes you don't get the strategy. Sometimes I'm sure that a lot of you have done do-it-yourself gender transition where you just figured things out by yourself, and it was putting one foot in front of another, and sometimes you made mistakes and you learned from them, and sometimes you course corrected yourself. But keep in mind, there is no particular order of gender transition. There's only your order of gender transition, and that order has to revolve around your needs. By any means, do not listen. There's no gender specialist on this planet who can honestly look you in the eye and say they're gender special and tell you there is actually an order to things. That's bullshit. But by all means, please also be mindful not to listen to trans people in trans community who impose the ways they went about things, right? So as I said before, just because somebody has gone through gender transition does not make them an expert. It does not make them a specialist. It just makes them a specialist in their own experience. And should you pay attention to other people? Yes, because they actually have gone through it. But at the same time, be mindful that the ways they've gone through things doesn't mean that's going to be your way too. You have to find your way. So you have to be very mindful of that. There's a lot of people who gone through gender transition, and now they not only generalized to everybody else, but now in a way they're kind of preach, I guess, said, no, this is the way, you're doing it wrong. What do you mean you haven't come out yet? Oh, no, you're supposed to do this first, because that's how they did it. So in a way, they're seeking validation by projecting their way onto you, because they don't want to think that I do mine wrong. There is no such thing that I do mine wrong. There's only your way. So figure out what's important to you. Figure out where you're at right now. If you're doing it by yourself, if you're working with therapists, have your therapist help. If you're doing it by yourself, figure out what is the most important thing for you and what is your environment circumstances are like. And then based on that, start creating your own order of things. And you may not get it right. And you may have to tweak it as you go along, and that's okay. That's part of the process. So keep that in mind. It is okay. It's part of the process. There is no primer. Remember that. Having said that, comment below. Let me know in what order you've gone through things. Did you feel like there was this primer you had to follow? Did you feel like anybody was pushing you into following particular primer? Comment below. Let me know. And I'll see you all next time. Goodbye.